Hey everybody, it's Dr. Galvin. I just filmed a COVID video, but I do need to continue talking about these 5 pillars of health that we alluded to a couple weeks ago. I'm a big believer that making small changes in multiple areas results in big permanent changes. It's sometimes surprising that you can make a huge change in a particular area and not really see much change. One of the things we see very often with weight loss is people will suddenly start working out, twice a day, every day, and they see nothing happen. You take that same person and you tweak their nutrition, you have them work out a little bit, make sure their sleep's better, control their stress, make sure their hormones are right, and they have huge improvements. So those are the 5 pillars of health: nutrition, fitness, sleep, stress, hormones. And we're gonna talk a little bit about nutrition, because nutrition is one that we see tons of videos on. It's on the press all the time. Do this diet, do that diet, everything. What do we know? Well, in my clinic, diet's a 4-letter word. Why don't we talk about diets? Why don't I like that word? It's because that diets are intrinsically a brief change. I'm going to go on this diet, and it implies you're going to stop that diet at some point. And if the behaviors you're following now have caused you to gain weight or become unhealthy or develop diabetes, and you go back to those behaviors, what do we think is going to happen? You're not going to keep that weight off. The majority of diets, we tell people, eat less, work out more. Well, it turns out they don't work. If you look at the science, 98% of restrictive diets fail ultimately. And so you really need to kind of get to these root causes. And when we talk about nutrition in our clinic, we really look at what's called functional nutrition, which means we need to look at the patient, look at what their labs show, look at what their genetics show, and try to craft nutrition that meets their needs. And very often, probably 60-70% of the time, it really has to do with lowering processed carbohydrates and lowering insulin levels, because insulin is a storage hormone. It causes you to store fat. And so if you have high levels of insulin because we're eating tons of processed carbs, then it's typically going to be a problem. But that's not everybody. And that's why there's no one size fits all with nutrition. For some people, they don't really have that problem. They don't respond that way to carbohydrates. And so instead, we might have to do something that's more moderate, like a Mediterranean diet, or we might have to restrict another macro. Maybe we need to cut the fat down because they've got genetic predisposition to gaining fat with higher fat diets. And we oftentimes use diets that, or again, I don't like to use that word, but we use lifestyles that are relatively high in fat because it actually drives weight loss for a lot of people, but not everybody. And so I think when we're talking about nutrition, it has to be a very individual discussion with your doctor, and they need to be able to do the right test, the right genetic testing and lab tests, along with asking the right questions to sort of figure out what is the correct nutritional program that works for you. And very often, I don't get it right all the time. We oftentimes will start with what we think is the right choice. And then if we don't see good response, we change things up. So you have to be willing to keep your mind open and realize that there's no one size fits all answer for nutrition. But when we talk about weight loss and reversing chronic disease, it is probably of those 5 areas the most important one. And we're going to get more into that later on in this series, but I'm going to talk about the next pillar in the next video, and that would be fitness. And there's some surprises in fitness as well. And again, I'm Dr. Jeffrey Galvin. I'm a board certified emergency medicine and functional medicine practitioner. I've been kind of posting lots of videos about COVID, but I really want to talk about my passion, which is wellness and longevity and anti-aging and things like that. So if you find this useful, please like us on Facebook, subscribe to our YouTube channel, and hit the little bell so you get updates when we post. I do read all the comments and everything else, and so if you have something nice to say, thank you very much. It kind of hurts my heart when people are mean, but I posted about COVID for 2 years. Plus I'm an emergency medicine doctor, so I've got pretty thick skin. But thank you for watching. I'll talk to you soon.